If you have hollow under eyes, there are not many over-the-counter options that are going to help with this, especially if this area is hollow due to genetics. But if it's hollow due to aging, one of the things you can do with skincare, if your skin can tolerate, is you using things like tretinoin or medical grade retinoids to try to create collagen induction in the area in hopes that you're going to get some volume restoration. But typically for this area, you need to do something non-surgical or surgical. And so the first option that you have is going to be things like PRP or PRF. This is where your blood is taken and it's spun, and platelets are turned into a gel matrix, and then it's put under your eye to create volume restoration and to induce collagen in the area. This typically is going to take some time for you to get the effects, and it's not going to give you like 100% satisfaction. So you're just going for incremental improvements in the area. So that's one option. The second option is going to be under eye fillers. Typically, we use fillers that are thinner in nature. So Volbella, Belotero, I use classic Restylane in this area. This is obviously going to depend on your anatomy. Not everybody's a good candidate for fillers. You also have to worry about people who have allergies or lymphatic issues. So again, this is another option, but you need a consultation. And in this area with fillers, it's also tricky because some people have both hollowness under the eye and they have fat protrusion as well. So you need a consultation to see if fillers is a good option. And then the third option that you have is going to be fat transfer. So this is usually done by plastics or like more advanced derm, where you're going to have fat collected from one part of your body, and then it's going to be spun and put into the under eye area. So with all of these techniques, the treatment option is one thing, but the technique and the person's expertise is also going to be the other thing that you need to rely on. I also want to say that when it comes to the under eye area, a lot of times the way the under eye area looks is a result of the fact that you've lost volume in your mid-face, okay? So sometimes we don't really need to do too much to the under eye area. We just need to give you mid-face volume restoration, and you will actually look less tired, because that's usually the look that the way people feel, where like, you know, they look at themselves, even if they've had enough sleep, they still look tired, right? And so if you've lost volume in the mid-face, then once we restore that, you're gonna have some improvement in the under eye area. So if you're not a good candidate for any of these things that I've mentioned, just doing fillers in your mid-face can actually dramatically improve the way that your eye looks. If you're in the DC metro area and you're interested in fillers, that's something that I offer in the office, then book a consultation. Let's see if you're a good candidate, if I can give you some rejuvenation in this area. And if not, I will definitely send you to people who I think are good. I usually send people to oculoplastics if they're a good fit, or to somebody who has PRP or PRF, because that's not something I currently have, but I'll probably have in the future.